How would you expect to find out the location of the emergency assembly point? By reading your employer's health and safety policy. Your colleagues will tell you. During the site induction. During a visit by the Health and Safety Executive, HS&E.
What is the one thing a first aider cannot do? Treat you if you are unconscious. Give mouth-to-mouth resuscitation. Stop any bleeding. Give you medicines without authorization.
Someone has fallen from height and has no feeling in their legs. What should you do? Raise their legs to see if any feeling comes back. Roll them onto their side and bend their legs. Keep their legs straight and roll them onto their back. Keep them still until medical help arrives.
Which two of the following will help you to find out about the site emergency procedures and emergency telephone numbers? Guidance from your local job centre. Looking in the telephone directory. Guidance from the Health and Safety Executive HS&E website. Attending the site induction. Reading the site notice boards.
Where should you be given information about emergency assembly points? At the site induction, in the permit to work, in the risk assessment, in the method statement. If the first aid kit on site is empty, what should you do? Find out who is taking all the first aid supplies. Bring your own first aid supplies into work. Ignore the problem as it is always the same. Inform the person who looks after the first aid kit. You witness a serious accident on site. What immediate action should you take? Give 2 answers. Lift the injured person and take them to the site office. Check if it is safe to approach the injured person. Call out to other workers so they can call for help. Record the date and time in the incident book. Sit the injured person up and give them food and water. What should not be in a first aid kit? Tablets and medicines, bandages, safety pins, plasters. Someone is knocked unconscious and you are not trained in first aid. What should you do first? Slap their face to wake them up. Send for medical help. Give them mouth-to-mouth resuscitation. Turn them over so that they are lying on their back. Someone collapses with stomach pain and there is no first aider on site. What should you do first? Get them to take some painkillers. Ask someone to call the emergency services. Help them to lie down in the recovery position. Ask them to sit down. Evacuation routes should be clear and unobstructed, lit at all times of the day, used as assembly points, painted bright green.
A first aider is required to have which one of the following? They must be a qualified nurse. They are expected to have doctor-level certificates. They should have a current, up-to-date first aid at work certificate. They must have a full and clean police check.
What 2 things should you do if there is an emergency situation on site? Leave the area via the nearest exit. Collect personal items from the site office. Look for other people who may not know what to do. Finish what you are doing. Go to the designated assembly point. If there is an emergency while you are on site, what should you do first? Follow the site emergency procedure. Phone home and then leave the site. Leave the site and go home. Phone the Health and Safety Executive, HS&E.
Someone working in a deep inspection chamber has collapsed. What should you do first? Raise the alarm and stay by the inspection chamber, but do not enter. Climb into the inspection chamber and give first aid treatment. Get someone to lower you into the inspection chamber on a rope. Ask someone to find your supervisor while you try to rescue the worker. What should be done in the event of an emergency on site? Leave the site by the nearest exit and return home. Phone the Health and Safety Executive, HS&E, for advice. Collect your personal items and leave the site. Follow the site emergency procedure.
How should you be informed about what to do in an emergency? Give 2 answers. By asking at the local hospital. By asking the Health and Safety Executive, HS&E. By reading the site notice boards. By looking in the Health and Safety file. By attending the site induction.
If you cut your finger and it won't stop bleeding, what should you do? Tell your colleagues because you may need to rest. Find a first aider or get medical help. Wrap something around it and carry on working. Wash it, then carry on working.
Does your employer have to provide a first aid kit? Only if more than 50 people work on site. Yes, every site must have one. Only if more than 25 people work on site. No, there is no legal duty to provide one.
What information should be gathered after a near-miss incident occurs? Where those involved lived at the time of the incident. The names of next of kin for the people involved. The cost of the project at the time of the incident. The activities that were being carried out at the time. If you find an injured person and you are on your own, what should you do first? Inform your supervisor that someone has been injured. Move the injured person to a safe place, then find your supervisor. Ask the injured person what happened and then find your supervisor. Assess the situation. Do not put yourself in danger.
Which of the following best describes an assembly point? A place to assemble in the event of an emergency, where the employer issues personal protective equipment. The location that staff should avoid in an incident. The place where an incident could be started.
If you think that someone has broken their leg, what should you do? Place them on their side in the recovery position. Place them on their back. Use your belt to strap their legs together. Send for the first aider or get other medical help.
If someone is in contact with a live cable, what should you do first? Dial 999 and ask for an ambulance. Pull them away from the cable. Phone the electricity company. Isolate the power and call for help.